although they recognize the test, it does not change the treatment model. So they're not going to run other tests if it's not going to change treatment. And I agree with that. If it's not going to change your treatment, you don't need to do the test. Unfortunately, with us, it does change treatment, because now we realize it to be an autoimmune case, and we manage it differently as a result of that. Now, if you go to your doctor and you say that you want this test done, they'll run it. It's a relatively inexpensive test. If you have insurance, insurance covers it. If you don't have insurance, maybe $10 or $15 test. But even if it's diagnosed as positive, it's not going to change your treatment. It's still going to be some type of medication to manage your TSH, and that's it. And if you still have symptoms, we're going to give you drugs for those things as well. So that's kind of where I believe that the ball drops. We need to understand that in order to have an autoimmune disease, we need to have three things present. One is you need to have the genes. So most likely that you probably have either a mother, a grandmother, an aunt, a sister, or somebody else suffering with thyroid problems. That's a clue that you probably have something genetic that has been passed down. That's the first thing you have to have. If you don't have the genes, you cannot develop the disease, whatever the disease might be. So if you don't have the genes for rheumatoid arthritis, you can never develop rheumatoid arthritis. So again, you have to be born with the genes. There's nothing we can do about the genes. You're born with what you're born with. The second thing you have to have is a trigger, and that's something that turns on the autoimmune response. We know that with different conditions, different triggers are known to activate the response. The primary factor that we see, or trigger, is something called gluten. Gluten is the protein that's found in wheat, rye, barley, and oats. And it's found in certain other products, but those are the predominant products. And gluten has been known to be the main trigger and the only known cure or treatment for celiac disease. So we know definitely with celiac disease, you can definitely not have gluten. We know it's a trigger and it's going to make you worse. So when somebody gets diagnosed with celiac disease, which is an intestinal problem, the first thing the doctors will do is get you off gluten. Everybody agrees on that. Where we differ is in how gluten affects other autoimmune conditions. We realize, and the research shows, that Hashimoto's patients as well do poorly as long as they continue eating gluten. Now, a lot of patients, when they hear this, the first thing they want to do is, I'm just going to go off gluten, which is good. But that's equivalent to your house being on fire, and all you're going to do is put the fire out. You need to actually go into the gut and rebuild the gut. You can't just go off gluten and expect yourself to get better. So it's something that we definitely have to look at, and it's definitely a known trigger. Some other triggers for Hashimoto's are vitamin D deficiency, iodine, pregnancy, estrogen surges like during menopause, insulin surges, if you have insulin resistance. These are just some of the common causes of triggers, actually, of Hashimoto's. They do not cause Hashimoto's, but they can turn it on. Once the disease process turns on, it doesn't go off. Now, we may be able to modulate your antibodies and maybe get you into a negative range or a zero range, but you still have the condition. That I want you to be clear of. Traditional healthcare, alternative healthcare, functional medicine, nobody cures this condition. What we help to do is modulate the genetic expression of the disease so you don't have symptoms. And that's our overall goal. So, the other thing I want to cover is 4 priorities. In our office, regardless of the name of the condition, we know that physiologically we need to look at 4 main priorities in the physiology. First one being blood sugar and cortisol. Like I said earlier, if a patient's blood sugar is out of balance, too high or too low, we can never get that sick patient better. It needs to be addressed. Second thing is cortisol. Cortisol helps to regulate blood sugar, so we absolutely need to know what cortisol does. Plus, cortisol is your stress hormone. So if cortisol is too high or too low, it will definitely cause an imbalance in the body and cause some of the other symptoms we talked about earlier. The next thing we have to look at, real common with hypothyroid, especially Hashimoto, is anemia. We have a couple different kinds of anemia. That's iron deficiency anemia, in which it'll cause you to be fatigued, maybe bruising easily. And these patients, typically, if they take iron, don't even feel better. We also have pernicious anemia, or B12 anemia. And these are patients, again, that are really tired. So if you have anemia, you're not getting oxygen to your cells. And if you're not getting oxygen to your cells, you can't get better. Your cells need 2 things to operate: glucose, or sugar, and oxygen. If you can't get them both of these things, the cell doesn't function the way it was designed to function. So we already explained how glucose is really important with blood sugar, and now I'm telling you how oxygen is important as well. The next thing we have to look at is the gut. Most of my patients come in here and they have some type of gut-related problems. And that's because the things that, after we looked at the triggers for autoimmunity, we look at leaky gut. Leaky gut is when large particles of food or substances leak out of the intestinal wall and go into the bloodstream. What that will cause is an immune response because the body recognizes this as being foreign, and then patients develop multiple food sensitivities, and they'll create this immune type response or allergic sensitivity to a particular food, like gluten or dairy. 80% of your immune system lives in your gut. So all of my patients come in and have a gut problem. And that's not really a mystery, because if I know they have an autoimmune disease, I know they have to have a leaky gut. So one of the priorities that we do in our office is help build up the gut, help build up the lining of the gut through proper nutrition, and alleviating some of the factors that we know help to destroy the gut. So real important to have good, healthy gut function. A lot of your thyroid hormone gets converted from T4 into T3 in the gut. So without a healthy functioning gut, you're not going to have healthy functioning thyroid. Real important, yet nobody really looks at this. The last thing we look at is the liver. Liver is responsible for detoxifying harmful and even helpful and beneficial compounds in our body. It takes things that are fat soluble, that are circulating around the blood, makes them water soluble so your body can get rid of it, either through saliva, through urine, through feces. Your body has to release these toxins. If the liver is functioning at a really high level, the body's able to do this. If the liver does not function at a high level, we have backup of these toxins and they get to circulate around the body, causing inflammation in the body. Our overall goal with these four priorities, blood sugar and cortisol, they kind of go together, anemia, liver, and gut, if they're out of balance or cause dysfunction, they cause inflammation in the body. Inflammation is the underlying cause of all disease in the body. So if you have inflammation, our overall goal is going to be, regardless of the name of the condition, is to decrease the inflammation in your body. And we have known ways that we do this. And it's just really fabulous and amazing to watch patients as they decrease inflammation. Some of the amazing things that we utilize are things like turmeric, powerful anti-inflammatory, resveratrol, glutathione, the motherlode of all antioxidants. Vitamin D is known to be an anti-inflammatory. Fish oils or essential fatty acids are also known to be anti-inflammatory. And these are amazing. So you have to decrease inflammation if we're going to help these patients get better. We utilize specific lab tests also to determine inflammation levels. Things like CRP, homocysteine, ESR. These are non-specific lab tests that tell us that there is inflammation in the body. It doesn't tell us exactly where it is, but it's a good monitoring lab that we can utilize to make sure that we're going in the right direction when managing these cases. Now we look at cortisol just one more time, because cortisol is real important. We need to have proper amount of cortisol made, which is, again, produced by the adrenal glands during times of increased metabolic demand or stress. Now, typically in the morning, cortisol should be the highest and it should be lowest at night. We have patients that when they develop dysfunctions with cortisol, it's actually a problem in their brain and not in their adrenal glands. And what that means is that their brain is not regulating the cortisol the way it needs to, meaning that you might be making enough cortisol, but at the wrong times of day. So if you're really low in the morning, that's patients that are going to be really sluggish and can't get out of bed even with 8 to 10 hours of sleep. If it's high at night, these are patients that can't fall asleep. If you wake up in the middle of the night, this is usually due to low cortisol and low blood sugar. So sleep disturbances, which is real common in my office, are always related back to some form of blood sugar or cortisol abnormalities. And we aim to uncover that through specific lab testing. The test that we utilize for cortisol, a salivary test. And we give you test kits in which you'll go home and spit into a tube 4 times in one day. 7 in the morning, 11, 4 in the afternoon, 11 at night. And that gives us a good reading as to where your dysfunction might be. Are you normal in the morning but high at night? Or where's the imbalance? Are you not making enough all day? Maybe you're flatlined all day. This gives us a really good reading. And we utilize one of the best labs in the country for these tests. If you get it checked in the blood, which is what most medical doctors will do if they're checking cortisol at all, it's only going to give you one reading. And if you understand what I'm saying right now, that we need to see the whole circadian rhythm of cortisol, we want to know when it's high, when it's low, what the body's actually doing with it. You need to look at it more than once in one day. So that's why we believe that our testing is really accurate and helps patients get better. The last thing I want to talk to you about is vitamin D. Vitamin D is a critical vitamin, and I think it's completely overlooked in the traditional healthcare model. Normal vitamin D levels, which is typically 32 to 80, could be 33 to 85. Different labs have different amounts. But typical lab values were determined back in the 70s when they were looking strictly at bone health. Now, they're absolutely correct. If you're looking just at bone health, as long as you're within that number, 33 to 80, you're absolutely fine and healthy. Now, today the research shows, and it's really all over the internet, you can Google, go to PubMed, P-U-B-M-E-D, and that's National Library of Congress, and they have tons and tons of research done on vitamin D and how it affects other things besides bone. Now we know that vitamin D is a powerful regulator of the immune system. It helps your regulatory T cells, which helps to modulate the immune system. If you have an immune system problem and you're not getting your vitamin D checked and treated or managed, you're doing yourself a great injustice. Vitamin D deficiency will present with diffuse muscle aches and pains, just kind of sore all over, and also an inability for the body's immune system to function at the highest level. So we look at vitamin D levels, and we like to get vitamin D levels closer to 80 to 100. So again, if you go to your doctor and you're at 34 and the cutoff is 33, they're going to tell you that your vitamin D is normal. Because if they don't understand the physiology of how it's involved in other physiological processes, they're absolutely right. But we understand how important it is, and we like to get those levels up nice and high. Vitamin D is also responsible for keeping that leaky gut nice and tight. So what happens in leaky gut syndrome, the tight bands that hold the gut together get loose. They're like rubber bands. We know that one of the things that helps to keep them really tight are vitamin D. So vitamin D helps to maintain the tight junctions in the gut and help to heal up a leaky gut. Problem with vitamin D supplementation is that if you go to Walmart and you buy your vitamin D, typically your body doesn't absorb it. Hashimoto's patients, about 98%, have problems absorbing vitamin D. They have problems with the receptor site. And if they have problems with the receptor site, they can't absorb it. In our office, we utilize an emulsified or broken down form of vitamin D, which is easily absorbed into the body, plus it has the necessary cofactors so the body can absorb those nutrients the way they need to. So we know it's not just about the vitamin D level, not just about the vitamin D supplementation. It's about monitoring the vitamin D level, making sure it stays at an adequate level, and then also taking the right supplementation to get those numbers up nice and high and keep them that way for a long period of time. Vitamin D, again, useful in helping to heal a leaky gut, keeping the tight junctions tight. It's good for the immune system. And again, if you have Hashimoto's or an immune system problem, any type of autoimmune disease, you need to have vitamin D at the higher therapeutic levels, which is probably 80 to 100. Another clue is that the RDA, which is the government agency that says how much vitamin D we need, the RDA is about 400 international units. So most people, even on vitamin D therapy, think they're getting enough by taking, again, a capsule a day at 400 international units. In our office, we typically utilize doses in the 6,000, 8,000, 10,000 international unit range per day. So 400 is not even touching these numbers. In fact, I just read a research paper that said that pregnant women should be taking somewhere around 4,000 international units, and lactating women should be taking 6,400 international units. And this was done by one of the vitamin D gurus, Dr. Hollis. He's out of University of South Carolina. He teaches in the medical school. He's a PhD in the pediatric science department. So anyway, I want to wrap this up now for you because I know you've taken a lot of time here. My goal with this video really was just to open up your mind as to the possibilities of why you may not be getting better with what you're currently doing. Where are you heading? If you keep doing what you're doing, you're going to keep getting what you're getting. The traditional healthcare model is absolutely great in managing acute conditions. Okay, so if you need stitches or have a heart attack or a broken bone, most of these traditional healthcare providers are absolutely essential, and that's who I want treating me. When it comes to handling some of these chronic health conditions, I believe that the ball's been dropped and that we need to handle these cases differently. So again, we support the patients through diet, nutrition, and lifestyle. We do this after we've received the testing that we've ordered and the comprehensive test that most doctors are not going to order. So again, we don't leave any stone unturned when it comes to managing these conditions and helping patients to achieve optimal health and wellness. So again, I thank you for your time. If what I said made sense, you need to do something. You need to ask yourself, where am I going to be in 3 years if I don't do anything about this? Can I afford to not do anything at this point? You know, where are you really going to be? And if you're miserable now, I promise you, the magic pill is not going to come out next week or next month or next year to manage all your thyroid problems and put it under one umbrella, and you're just going to go away and get monitored every 3 months with your TSH. It just doesn't happen that way. I told you it's a complex web, and we need to uncover it all, almost like unraveling an onion. So, again, if what I said made sense and you want to move forward, please take advantage of the offer we have for you today, in which we're going to give you a discounted consultation fee just for listening to this DVD. I encourage you to take action, and with action you will get results. I can't promise results, but I can promise that I will do everything I possibly can to help you improve the quality of your life. Thanks, and have a great day.